This is Vamshi Krishna. So in this video we will see basic questions for the mhsrb examination in Telangana. So the first question is, what is the date we celebrate Doctors Day? Okay, what is the date we celebrate Doctors Day? Options are today, yesterday, day before yesterday, otherwise tomorrow. So what is the date? So the right one is option A, today. So the today date is 7th, sorry, 1 7 2023. So 1st July. So 1st July is the Doctor's Day. So we are celebrating today Doctor's Day. Option A is the right one. The next question is, septic shock can be. So what is the meaning of septic shock? Options are, it is due to the infection, otherwise allergy, otherwise fluid loss, or nerve damage. So what is the right answer? So the right one is a infection. So always you remember that septic shock can be occur due to the severe infection. Okay, severe infection. Otherwise, it is known as the septic shock. Okay, so the infection is when the body is severely infected with the any microorganism such as bacteria and viruses, when it is leads to the multiple system failure, so it is known as the septic shock. So we have the other types of shocks, that is cardiogenic is due to the heart function failure. Okay, and anaphylactic is due to the allergies. Hypovolemic shock is due to the decreasing of fluid in the body. And respiratory shock, so it is due to the failure to respiration, otherwise absence of breathing. It leads to the ischemia, decreasing of oxygen in the blood. So these are the some of the types of shocks. So the next question is, which are the following of central venous catheter uses? So when we are working in the hospital side, so the patient has undergone the central venous catheter. So what is the use of having the patient with the central venous catheter? Option A, it is for the continuity of the treatment. So when we are give the a treatment continuously 24 into 7, so are we using the central venous catheter? Otherwise, to administer the heavy fluids. So to continuous administration of the fluids to the body. Otherwise, to draw the blood samples. Okay, option C, draw the blood sample. Option D is the all of the above. So it may be some kind of confusing. You may think that all these three are right for the central venous catheter US. But when you think critically, the central venous catheter is mostly used for the first priority is to give the administer heavy fluids. So when we are giving to continuous fluid administration, fluids are nothing but medications, IV fluids. Okay, so when we are giving continuous fluid administration for the patient, we are using the central venous catheter. The next one is, which sign is positive in intrauterine fetal death? Options are placental sign, Human sign, Piscus sign, and Spalding sign. So which one is the right answer? So the right one is the Spalding sign. Option D is the right one. So what is the Spalding sign? So this Spalding sign can be observed by the ultrasound. Okay, ultrasound. So when you are assessing the a mother with the intrauterine fetal death, so there is a overlapping of fetal skull bones. Okay, fetal skull bones are overlapped due to the collapsing of the fetal brain. Okay, when the fetal brain is collapsed, so what will happen? There is a overlapping of overlapping of skull bones, skull bones. So the Spalding sign can be observed by the ultrasound due to the overlapping of skull bones. It is occurred by the fetal collapsed brain. Okay, when the fetal brain is collapsed, so in that condition, overlapping of the fetal skull bone. So this is the Spalding sign. So the next one is a Human sign. So this Human sign can be observed in deep vein thrombosis. Deep vein thrombosis. So when the lower limbs, the veins which are present in the lower limbs, when there is a clot formation, okay. So deep vein thrombosis, in that condition we can see the Human sign, Homan. That is Human sign. And the next one is what is placental sign? So when the women are observed that blood spotting, okay, blood spotting. So in that condition, there is a risk for the, okay, there is a risk for the bleeding, internal vaginal bleeding, mainly in the placenta previa, otherwise abruptio placenta. Okay, so there is a bleeding in the uterus. So this sign can be called as a placental sign. And finally, what is Pisac sign? So this is known as the uterine softening. Uterine softening in early pregnancy. So that is called Piscasek sign. The next one is a in the dark skinned child. Mostly can be observed which part of the body for the jaundice. So as a nurse you were working in the hospital, so the black colored child came to the hospital with the complaints of excessive crying, okay, or not breastfeeding. So you thought that the baby may risk for the jaundice. So jaundice. So due to the color of the baby, you cannot find the jaundice over the skin. So firstly appear the yellow discoloration in the body, where we can observe the yellow discoloration of the body in the black color child. Options are eye, feet, roof of the mouth, abdomen. So the right one is the option C, roof of the mouth. So mainly in the case of black color child, we can observe the jaundice for the roof of the mouth. So if you see here, we have the Kramer's rule. Okay, for this is for the normal color child. So according to the modified Kramer's rule, if it is on the face, it is about the 4 to 6 mg, and if it is on the chest and abdomen, 8 to 10 mg per dl, and if it is lower abdomen and thigh, it is about 12 to 14 mg. Otherwise, if it is on the arms and lower legs, 15 to 18 mg. Finally, if you observe the palms and sole, so you may think that it is about 15 to 20 mg per dl. So you have to come from up to down. Okay, so finally palms and sole. So this is the Kramer's rule. The next one is a mother taking hydroxyprogesterone contraceptive as a nurse advice for which of the following? So for which of the following she has to advice for the mother? Options are iron for anemia, vitamin C for infection, magnesium, calcium for bone. So which advice you can give the mother when she is taking medroxyprogesterone? The right one is the option D, calcium for bone. The next one is a iatrogenic effect refers to as. So what is the meaning of iatrogenic effect? Options are drug reaction, illness due to the treatment, due drug reaction during the pregnancy, none of the above. So the right one is option B, illness due to the treatment. So when we give the treatment for the patient, so due to the treatment mistakes or something else, so when the patient is illness due to the treatment is known as the iatrogenic effect. Otherwise, the drug reaction during the pregnancy is teratogenic effect. Teratogenic effect. So the right one is option B. The next one is the length of the fallopian tube. 10 centimeters, 12 centimeters, 8 or 5 centimeters. So the right one is option A, 10 centimeter. So in some of the books we can see the 10 to 12 centimeters fallopian tube length, but average length is 10 centimeters. The next one is the precocious puberty is known as. So what is the meaning of precocious puberty? Options are when the girl is mature less than the 10 years or more than the 10 years after 16 years, none of the above. So the right one is option A. This is early puberty. So this is called precocious puberty. The next one is Down syndrome. It is a trisomy is due to. So what is the abnormal chromosome we can find in the case of Down syndrome? Option A, 13 number of chromosome. Option B, 18 number of chromosome. Option C, 21 number of chromosome. Option D, 45 number of chromosome. The right one is option C, 21 number of chromosome we can observe in Down syndrome. So here we have some of the numbering. 13 number chromosome is due to the Patau syndrome, 18 number for the Edwards syndrome, 21 is the Down, and 45 is the Turner syndrome. The next question is, which are the female pelvic joint? So female pelvic joints, how many joints we can observe in female pelvis? So this is some kind of pelvis. So option E, sacroiliac joint, sacrococcygeal joint, symphysis pubis joint, all of the above. So the right one is option D, all of the above. So we can observe sacroiliac joint. So sacrum and ilium, the joint between the sacrum and ilium. The next one is a sacrococcygeal joint. So this joint is between the sacrum and coccygeal, and symphysis pubis. So symphysis pubis we can observe anterior portion of the pelvis. Okay, so this is called the symphysis pubis joint. So the right one is option D. The next one is a Johnson formula used to assess. So what is Johnson formula and what is this use? Options: to identify the gestational age, otherwise. Option B, fetal weight. Option C, fetal well-being. Option D, fetal anomalies. So the right one is fetal weight, option B. So Johnson formula we use assess for the fetal baby, fetal baby weight. So in this fetal weight equal to fetal height, sorry, it is fundal height into 155. Okay, this is the formula we will use for the fetal weight. The next one is the new nurse said that the gynecoid pelvis is not suitable for childbirth. So is it true or false? So the new nurse, she said that gynecoid pelvis, okay, so we have the four types of pelvis: gynecoid, android, anthropoid, and platypeloid. So among these four pelvis, which is the preferred pelvis for the childbirth? So the new nurse, she said that gynecoid pelvis is not suitable for childbirth. So it is true or false? So what is the right answer? Please put in the comment section. So the right one is a option B, false. Why? Because gynecoid pelvis is a most preferable pelvis for the childbirth. The next one is the pregnant mother accidentally fell on the floor. Then she scared about the baby in the womb. Then she asked the nurse to which one is protected my baby. Okay, so do you understand the question? The pregnant mother, she fell on the floor while sweeping the house. Okay, so when she fell on the floor, then immediately she came to the hospital and she asked the nurse which one is protected my baby. Okay, so after some of the examination and everything, the baby is in the womb is good. So doctor said that your baby is well-being, ma, so nothing is happened to you and your baby. So she has the doubt, the mother has a doubt, and she asked to the nurse, so which one is protected my baby? Options are uterus, amniotic fluid, pelvis, and buttocks. So what is the right answer? So if you understand this question, please put in the comment section. Okay, so the right one is a option B. Okay, so amniotic fluid, it is act as a shock absorber. Okay, shock absorber. So due to the presence of amniotic fluid in the placenta, so when there is a little fall, otherwise when there is a some little accident, okay, so for some level the amniotic fluid can prevent the baby injury. Okay, baby injury. So the right one is the option B. The next one is which of the following position is advised to relieve cord compression during labor? So during the labor, there is a risk for the cord compression. So as a nurse, which position you will prefer for the mother during the labor? Option A, supine position. Option B, left lateral position. Option C, prone position. Option D, lithotomy position. So the right one is a option B, left lateral position. So in normal delivery, normal mother, we will prefer the lithotomy position for the childbirth and perineal care, perineal examinations. So the right one is option B, left lateral position. The next one is the fresher nurse advised to give oxytocin drug. Okay, so one of the fresher nurse, she recently completed the BSc nursing, okay, or GNM course, and she is posted in the labor room. Okay, she is a junior nurse. She posted in the labor room, and the doctor advised to give oxytocin drug for the mother during labor. So according to her educational theory knowledge, she confused with the what is the use of oxytocin, okay, and what is the mechanism, and you have to tell about the purpose of this. Okay, the fresher nurse, she advised to give the oxytocin drug to the mother, and she confused with the use of oxytocin mechanism. And so main the question meaning is the during labor, doctor has why he has advised a oxytocin drug. So the options are option A, stimulate breast glands or mammary glands, or option B, for uterine contractions, option C, milk production, option D, all of the above. So what is the right answer? The right one is option B, for uterine contraction, to take the child birth. So according to her theory knowledge, she may confused that oxytocin it is used for the, so she may confused with the oxytocin mechanism. So it can be used for the milk, otherwise lactation. Okay, breast milk lactation. So the right one is the option B. Oxytocin is used during the labor for the effective uterine contractions. So this is end of my class, guys. Thank you for watching, and please subscribe, share with your friends.